This section offers a suggested method for implanting the AccuLock targeted distal radius plate. For specific questions not addressed here, please contact your local Acumed representative or contact Acumed directly, either at 888-627-9957 or on the web at www.acumed.net. The AccuLock targeted distal radius plate is designed to treat acute fractures, non-unions, and malunions of the distal radius. Reduction of the fracture is usually obtained by applying force in the opposite direction of the injury. For example, dorsal bending fractures are reduced by applying longitudinal traction, palmar flexion, ulnar deviation, and pronation. The patient's forearm is supinated to expose the surgical site. To maximize exposure, a towel is placed under the wrist, placing it in extension. Make a longitudinal incision approximately 6 centimeters in length, just radial to the FCR tendon, to protect against potential injury to the palmar cutaneous branch of the median nerve. The tendon sheath is opened and the tendon is retracted radially to protect the radial artery. The flexor pollicis longus is identified by passive flexion extension of the thumb interphalangeal joint and is retracted ulnarly to protect the median nerve. Next, the pronator quadratus is identified by its transverse fibers and is released radial to ulnar to expose the fracture site. The fracture is reduced and evaluated under fluoroscopy. The brachioradialis may need to be released from its insertion on the radial styloid to facilitate reduction and visualization. There are 3 different plates in the set, each with a left and right option. Left plates are blue, right plates are green. The standard plate is typically used. However, if the fracture extends proximally, the long plate may be needed. If the distal radius is wider than normal, the wide plate may be selected. Once the correct plate is selected, attach the appropriate targeting guide to the plate using the targeting guide screw. The plate is made to sit along the distal aspect of the distal radius to support the volar articular fracture fragments. To temporarily hold the plate in place, an 045 or 054-inch K-wire may be placed through one of the small holes in the shaft of the plate. To determine the position of the distal locking screws relative to the articular surface, a second K-wire may be placed through the distal holes on the plate. The fracture reduction, position of the plate, and the location of the distal K-wire relative to the joint is assessed under fluoroscopy. If the distal K-wire does not penetrate the joint, the subsequent distal locking screws will not as well. Place the first 3.5 mm cortical screw through the slot in the plate. The position of the plate relative to the articular surface may be fine-tuned by sliding the plate proximal or distal under fluoroscopy. Using the drill and the drill guide, drill through the near cortex. Drill depth is measured with a depth gauge. Insert the appropriate silver 3.5 mm screw, taking care that the screw does not exit the bone dorsally. Select one of the 4 screws closest to the joint to target first. There are 3 types of screws that can be used in any of the 8 distal holes: fully threaded locking screws, smooth locking pegs, and non-toggling screws. Insert the drill guide into one of the holes, followed by the 2.0 mm drill. The depth of the screw is measured using the laser mark on the shaft of the drill and the scale on the drill guide. An alternate way to measure the screw length is by using the depth probe and measuring the screw length with the laser mark. A gold-threaded locking screw is then inserted. A bronze smooth locking peg may also be used. A second distal screw is inserted using the same drill and drill guide. It is up to the discretion of the surgeon when to use the threaded locking screws and when to use the smooth locking pegs. The thread pitch on the threaded locking screw is the same from the tip to the head, minimizing the differential pitch effect as the screw is tightened into the plate. Using the same process, drill and insert the 4 remaining locking screws. The final 2 distal screws are the radial styloid screws. These 2 screws are targeted from the back of the targeting guide using the dual hole. The radial styloid screws are designed specifically to target and support the radial styloid fragment at angles of 35 and 47 degrees from the plate. An alternative method to drilling the distal screws is available with the AccuLock plate. An individual locking drill guide is available in the system that threads into the 8 distal locking holes individually. Screw length can be read using the depth gauge. Select one of the 2 remaining proximal holes and insert the threaded drill guide if a locking screw is desired, or the standard drill guide if a non-locking screw is needed. Drill depth is measured with a depth gauge. Insert the appropriate light blue 3.5 mm locking screw, taking care that the screw does not exit the bone dorsally. Using the same process, drill and place the final locking screw. Following thorough radiographic evaluation, the wound is closed. Start immediate finger range of motion and forearm rotation post-op. Allow early functional use of the hand for light ADLs. Support the wrist according to bone quality and stability.